Today, we're continuing our celebration of Hispanic Heritage Month, celebrating our people and our pride.
At 60 million strong, Hispanics have faced the disproportionate burden of COVID-19 throughout the pandemic, but it's far from their only health challenge.
Yeah, ABC 13's Rita Garcia shows us how one local woman made it her mission to conquer cultural barriers and change the way Hispanics treat Alzheimer's disease.
My mama was a dancer. She loved to dance. She lived here in Houston, migrated from Panama City, Panama. So we are Panamanians, born and raised. Hola, my Latina people.
Cheryl Mayers loves to tell her mom's story. It's a passion and now her mission since Dorothy died in 2016 after living with dementia for 7 years. Watching her mother slip away was painfully tough, but the duties of caregiving were even tougher on Cheryl.
Because there were thoughts that I was having that weren't godly thoughts. Because of the frustration about the stress.
Like many people with loved ones with Alzheimer's or dementia, Cheryl quit her job, moved her mom in, and became her full-time primary caregiver. But her experience was different from that of many white families.
To me, demente is that she's beginning to be out of her mind. Because in our Spanish language, dementia means the mind, you're out of your mind.
From the onset, Cheryl quickly realized her understanding of the disease, just based on the Spanish meaning, wasn't accurate. After a phone call, she says she understood that this was more than just learning about a disease, but breaking stigmas and helping people understand that cultural norms can sometimes be a setback in recognizing the early stages of the disease, which is so crucial.
We got to keep Abuela in the back room, even though when family or friends come, she talks to herself or she repeats stuff because we are ashamed of whatever would come out of their mouth.
In 2020, the Alzheimer's Association did a special report on ethnicity and perceptions or beliefs. They found Latinos are 1.5 times more likely to either have or be at risk for Alzheimer's than whites. Hispanic Americans, more than any other racial or ethnic groups, are also more likely to believe that significant loss of memory or cognitive abilities is a normal part of aging and not a function of the disease. The survey also found 1 in 5 Hispanics say they'd feel insulted if a doctor suggested a cognitive assessment like Alzheimer's. 36% of Hispanics did not believe they're getting good care from their doctors, and they don't trust the medical profession.
So if you do not trust the medical profession and don't think you're getting good care, you are not as likely to go out and seek care until there is a crisis. And unfortunately, at that point, sometimes it's a bit too late.
Anne-Marie McDonald is the Chief Program Officer here at the association's Houston and Southeast Texas chapter and says health inequities like lack of access to care and environment are also contributing factors. That's why they've ramped up their efforts to reach the Latino community. Their website translates to Spanish. They've got a 24-hour helpline in Espanol. They've recruited bilingual volunteers like Cheryl, who also helped launch support groups in both languages. Before Dorothy passed, Cheryl says her other fear was her own health and being present for her family. Thankfully, she had a big support system and the means to move her mom in, which is not always the case. If anything, though, she says, know that help is available. And she is, too, trying to bridge the gap between Latinos and the Alzheimer's Association.
Well, right now, more than 6 million Americans are living with Alzheimer's, and it's projected that by 2050, the number will increase to nearly 13 million. Unfortunately, during the pandemic, the association says an increase in deaths went by 16%.